Then we're just going to jump right into it with Sam Flynn here, the Executive Director of the Kentucky Medical Cannabis Program. He was appointed in that role by the governor in June of last year, and he oversees the creation, design, and implementation of the Kentucky Cannabis Program. Welcome, Sam.
Thank you so much, Jennifer. I really appreciate it. And I appreciate KACo having us on for this very important subject matter, and to be able to share a lot of the information that we have with all of you, and how that's going to impact your communities. One of the things that we'll be doing over the next several months, now that all of our implementing regulations are out, is meeting with local leaders, including yourselves. And we met with the Magistrates and Commissioners Association this morning in a very similar manner. We'll be reaching out to all of the ad districts as well, and trying to get our message out there about what this is, and not from an advocacy standpoint, but from an education standpoint. Again, we want the local officials and local governments making the decisions for their community, and not coming between them and their constituents in any way. So why we're here today is to provide information about what our program is, recent changes in the law, recent changes with respect to the regulations that we've promulgated, and what that means. And there's sort of several layers to this. So with respect to the businesses and how they're required to operate, with respect to patients and how they'll interact with this system and the state. And then finally, the cannabis business licensing, which will be the next piece, and then how that interplays with, of course, local government. So I'm going to share my screen and get started. One moment, have your indulgence. Let's see. Can you all see that?
I don't see it yet.
How about
there it goes. It's going.
All right, great. Let's see if I can get working through this. All right, so just the agenda, as I mentioned before, I'm going to give a little background about the timeline, about us. So the Kentucky Medical Cannabis Program, what is it? So medical cannabis, as you all know, was legalized through the passage of 2023 Senate Bill 47. It put the authority and the duty to regulate medical cannabis in the Commonwealth with the Cabinet for Health and Family Services. There was no organizational structure for what will become the Office of Medical Cannabis under that law, and so it was named the Kentucky Medical Cannabis Program. Due to changes in the law with House Bill 829, this will be referred to as the Office of Medical Cannabis beginning July 1 of this year. So again, our mission is to ensure Kentuckians suffering from severe medical conditions have safe, affordable access to medicinal cannabis. We want to make sure that this is a safe program for patients. We want to make sure that these are medical grade products. We want to make sure that this is truly about healthcare and that it is secure in your communities. This is our executive leadership. Of course, the cabinet is led by Secretary Friedlander, and these are the members of my team. We have two divisions, division for licensure and access. That's the division that will obviously do the licensing for the businesses and ensure that patients have access through approving applications. We also have a division of enforcement and compliance, which will make sure that the businesses are complying with all the rules and regulations that we've set forth. We also have two attached boards. One is created by statute. It's the Board of Physicians and Advisors. It's made up of doctors and nurses that were appointed by the state licensure boards. And they make recommendations both to the cabinet and to the General Assembly about what this is going to look like from a medical standpoint. So what are the qualifying conditions? How much THC is allowed in a specific product? What are the consumption methods allowed? And so when we talk about that, we're talking about what's legal under our law, edibles, vaping or nebulizing, creams and ointments, topicals, things like that. Smoking is not allowed. Also, with the passage of the new law, vaping is not allowed in public accommodations. So that's that's what that looks like. That board will take a look at those rules and requirements and make recommendations on this is the right thing. This is something we may want to look at changing. The next is the Team Kentucky Medical Cannabis Work Group, created by executive order to study policy in Kentucky and nationwide to ensure that our medical cannabis program is essentially first class with respect to medical cannabis, and again making sure that this is a safe program, that this is a secure program, and that we're truly serving folks that have serious medical conditions, as well as making sure from a business perspective that we are doing what we need to do to ensure that we have a safe and stable workforce, and that employers and employees understand, how this is going to work for them. And, I will just highlight for a moment, I know Judge Mueller was slated to speak. I can't thank him enough for his willingness to sit on our Team Kentucky Medical Cannabis Work Group. That work group, just to highlight one of the things that work group's done, is create a guide for occupational safety and health in conjunction with the Department for Workplace Standards. And that guide is going to assist employers and employees, making sure that, cannabis is like every other industry, but it does have unique challenges. We want to make sure that our workforce is truly safe, and that employers and employees both understand those responsibilities. So we can't thank the work group enough for that. And just to move along, so timeline, what does that look like? So medical cannabis and the conversation around this has been going for several years, but the real momentum for this started in April of 2022, when the governor announced that our administration would be looking into doing some research around medical cannabis, then forming the Medical Cannabis Advisory Committee, which many of you may remember went around the state, had public sessions where they took comments and feedback, and then issued ultimately a report with findings. And those findings showed that there was overwhelming support for medical cannabis in the Commonwealth. In the interim, while waiting for the General Assembly to come back to session and start moving in this direction, the governor also signed an executive order granting a prospective pardon. Again, this does not legalize cannabis, but grants a prospective pardon to folks that have a medical cannabis card from another state, and that individual complies with several other requirements, including having less than a certain threshold of cannabis. Moving on from that, so Senate Bill 47, again, that's the authorizing legislation passed March of last year, signed into law by Governor Beshear. And on June 1st, I was lucky enough to be the one appointed to implement this program. In the time since, and we've made, I think, some really great progress. We have a statutory deadline under Senate Bill 47 to have all of our regulations complete by July 1 of this year. As of April 18th, as you can see on your screen here, of this year, we have all of those regulations issued. So we're about 2.5 months ahead of schedule with respect to the regulations. We're required to set up some IT systems that we'll talk about a little bit later, including a track and trace system, which will allow us to track all cannabis from the seed to the sale and back, to ensure that businesses are complying with the rules and regulations, as well as a patient caregiver registry, and of course, business licensing portal. So again, back to the regs. On January 4th, we filed our first 10. Those are related to business operations and what the license types. So like, what is required at a dispensary, right? What kind of security, what kind of door locks, the rules and requirements for that facility. Same for cultivators, processors, producers, and safety compliance facilities. Safety compliance facilities, I know it's a long word. It means testing lab. As well as some of the other requirements that are out there around advertising, transportation, etc. So those were filed January 4th. They've been through the notice and comment period, and we intend to file after comment amendments to that on the 15th of this month. In the meantime, we filed 5 regulations on March 14th related to patients and caregivers. that sets sort of what our process is going to look like and how individuals are going to apply for a card and how that process works. And then in the intervening time, the governor signed on April 17th, House Bill 829, which makes some changes to the law, including as it relates to local governments. And we'll get into that momentarily. And then finally, the next day, we filed our business licensing regulations. And we can move on to talk a little bit about that. So we've talked about Senate Bill 47, what it does. So it provides for the legalization of medical cannabis starting January 1 of 2025, so this coming year. It authorizes the cabinet to regulate. It authorizes the cabinet to issue medical cards on that date, and our cards will be digital, and we can get to that as well. And of course, to do that, we have to have medical practitioners who write certifications to those individuals. That process is governed by regulations that were issued by the Kentucky Board of Medical Licensure and the Kentucky Board of Nursing. Those have been through the notice and comment period and are currently effective. So those boards will begin the process of allowing individuals to start applying to become authorized. And there's some education pieces around that to write certifications in the coming months. And one of the things that we're going to do is ensure that there's a directory of those so patients can see what physicians are actually authorized to do that and where they can get in contact with those folks. Again, so Senate Bill 47 is codified at KRS Chapter 218B. Just for the folks that are interested in the local government pieces, those are at 218B point 130. So if you have questions about that, take a look there. So moving on to new legislation from this year. So the first things first is House Bill 6. In short, we were appropriated funds to actually effectuate this. There was some question about whether those funds would be available based on some language in the budget, which you see here. It required the Board of Physicians and Advisors that we talked about earlier to make a finding that medical cannabis, or that there is sufficient evidence that it is effective for the reduction of symptoms of diseases and conditions. The board made that finding on April 15th, so our program can move forward. Now, with respect to House Bill 829, apologize that I'm talking so fast, but there is a lot of ground to cover. So again, apologies. House Bill 829 creates some new substantive pieces to medical cannabis law here in the Commonwealth. First, it creates an Office of Medical Cannabis to administer the program within the Cabinet for Health and Family Services. So that's my office. It provides us with some powers and authorities to actually implement these regulations. And we certainly appreciate Senator West and Representative Nemes's very hard work on all of these pieces. Couldn't have done some of this without them. So we just want to thank them for that. It also moves up the licensing timeframe for cannabis business licenses from January 1 to July 1st, 2024. A little bit about that. So the way the law was originally written, on January 1, 2024, folks were going to begin applying for medical cannabis cards. That was also the first day upon which we could begin licensing businesses. Obviously, if you're getting a medical cannabis card and businesses are being licensed, right around the same time, there's not going to be any cannabis on the shelves, right? So nowhere to actually purchase it. So we worked with the legislature to address that issue, and they were aware of it as well. And so with that, we were able to move up the time frame for business licensing to July of this year, and we're prepared to do that, as we'll talk about. A couple other pieces. It removes a provisional registration receipt loophole, and just tell you a little bit about that. Under the original law, an individual could apply for a card, and when they applied, regardless of whether they'd been approved or not, they would receive a provisional receipt that would have allowed them to go out and purchase 45 days worth of medical cannabis, again, whether they were approved or not. And even if we had denied them, they would have been able to go back to the well over and over and over again. So we worked with the legislature to address that loophole and make sure that the only people that are going to have access to medical cannabis truly are those who are approved after having their applications reviewed by our office. And then finally, as I mentioned, there's some new rules and regulations related to local governments and how the opt-out process works. So regulatory updates. We talked about the 17 regs that we've put out. First, around businesses and how they'll operate. Second, around patients, designated caregivers and practitioners. And finally, around business licensing. The first 15 are ordinary regs. The business licensing regs were filed as ordinaries and emergencies. So those licensing regs are effective as of today. So beginning July 1, we will open up the licensure portal that will be available on our website. And I highly recommend anybody who is interested in how that process works, please visit our website. It's kymedcan.ky.gov. If you have any questions, we have a contact us portal, and I've also dropped my email into the chat. So please, if you have questions, reach out. I'm happy to talk to any one of you on an individual or on a group level. So please do that. So licensing opens July 1, 2024, closes August 31st of 2024. And we'll get into sort of what that looks like. Again, license types. We have cultivators. They grow medical cannabis, required to be indoors in the Commonwealth. We'll get to how many there's going to be here in a moment. Processors. Processors take raw plant material and convert it into finished products that will be consumed by medical cannabis patients. Producers, it's a cultivator and a processor together. Safety compliance facilities, as I mentioned, that's the testing labs and ultimately dispensaries. We're all familiar with that, what that's going to look like. What I will note on dispensaries, because we get this question a lot, folks will ask, are these going to be like these Delta 8 smoke shops that we have seen? The answer to that is no. These facilities, as you'll see in our regs, are very tightly controlled. The types of products that they're allowed to sell are tightly controlled. It will be the safest, most secure pharmacy atmosphere that you have ever seen. I assure you that. There's not going to be food sales. There's not going to be sales of anything that would allow you to smoke a product. So no lighters, no matches, no bongs, no blunts, no pre-rolls, nothing of that nature. No hemp-derived cannabinoid products. These is truly a medical product that these dispensaries are going to be providing. These are not like gas stations. They are not like smoke shops. They are like the safest pharmacies that you can imagine. Next, and just to go along with that, we have significant rules and regulations around the kinds of security and locking systems on these facilities, on age restrictions related to these, as well as very strict testing requirements. We again want to ensure that these are truly medical grade products for folks with very serious medical conditions like cancer, PTSD, MS, etc. Now to the licensing system itself. So again, portal opens on July 1, closes August 30th. Everyone will have an opportunity to cure their application if there's anything wrong with it, and we will let them know. Once all of that has occurred on October 1, we will provide everyone with a determination. Either your application is complete and you go into the lottery, or your application is not complete and you are denied. For all the ones that go into the lottery, if you are selected in the lottery, you will have 15 days to pay your non-refundable application fee. If you are not selected in the lottery, you will receive notification that you have been denied. That entire process will be publicly viewable, and we're doing that with the Kentucky Lottery Corporation, who are professionals at this. They literally do a drawing every single day of the year, even on Christmas, and they do not miss a draw. So these folks are truly professionals. We have an MOU with them and very strict rules around how this process will work, and we'll get into that shortly. Now, the initial license availability. So we have looked at other states and how this has worked in all 37 states that have medical programs. One of the things that we noticed is that in states that allow anybody to grow this, there are problems. We want this to be a limited program in the sense that we have a safe and sustainable market. And as our patient demand grows, then so too our supply can grow. It's very easy to grow a market. It's very, very hard to contract one, as we've learned from Oklahoma and Michigan and several other states. So with that, we will have 10 tier 1 cultivators in the state. That's the 2,500 square foot cultivation, again, indoor facilities. That's the smallest, so more of like a micro cultivator. The second is a tier 2 cultivator. Those are 10,000 square feet, so 4 times the size of the first one. There'll be 4 of those throughout the state. Again, there's no requirements on where those can be. Tier 3, those are 25,000 square foot facilities. Those are substantial facilities, and there'll be 2 of those initially allocated. 10 processors and 48 dispensaries, and we'll talk momentarily about what those dispensaries look like. With respect to safety compliance facilities, there's no initial limitation. Again, these are the labs. Most states have anywhere between 2 and 5 labs doing this. And so we want to encourage folks to get in this space because we do need these products to be tested. We need them to be safe. And that's what we're going to encourage. And these are very, very small facilities at that. So these are dispensary licensing regions. So important to note, these are for licensing only. If an individual in Knott County wants to drive to Spencer County to buy medicinal cannabis, they certainly would be able to do that, right? Again, so there are 11 regions. 4 dispensaries are allocated per region, except for the Jefferson County region and the Fayette County region. Jefferson County gets 2 dispensaries, Fayette County gets 2 dispensaries, and then the surrounding counties for those, there are 4. All the other regions, there are 4 dispensary licenses allocated. Only 1 dispensary can be licensed in each county. So for many of you, that means that there may not be a dispensary licensed in your county. We did this so that we can ensure that, one, that this is secure, and that there aren't dispensaries on every corner like there are in some states. So if you go to Michigan, or if you were to go to Colorado or Oregon or Washington or California, you might see dispensaries everywhere. That will not be the case here in the Commonwealth. There will be 48. There's likely not going to be one in your community, based just on the math. And so that's what that looks like. We also wanted to ensure, and this is where the regions come in, that there's geographic spread. We understand that, a person with stage 4 cancer may not want to drive, from Knott County to Jefferson County or Fayette County to, get the medicine that they need. So we want to ensure that those folks that are in rural areas still have access. And we worked with the Kentucky Transportation Cabinet to develop this map. It's very similar to the driver's licensing regions, if you notice. And what it does is ensure that a significant portion of the Commonwealth is within an hour's drive time at most of a medicinal cannabis dispensary. And I'll show you what that map looks like. So this is a drive time analysis based on if the licensees, so this is a hypothetical, but if the licensees were awarded in the largest counties in each region, or the largest cities in each region. And this is sort of what that would look like. Of course, green is from 0 to 15-minute drive time. Yellow is 15 to 30. Orange is 30 to 45. And red is 45 to 59 minutes. Everything in white, which there's very little, as you can see, would be outside of that hour's drive time. There's about 3,800 people that live in those areas. Again, this is a hypothetical based on ideal circumstances. So our map will probably not look like this. When we do have dispensary regions, we will rerun this and see what that looks like. Again, licensing fees, they're non-refundable. There's an initial fee and a renewal fee. The lottery process, again, all of this information is on our website. I won't go through exactly the minutia of that, but it will be publicly available. Okay, patients and caregivers. So what does an individual got to do? You're probably going to get questions about what do I got to do to get a medical cannabis card? That person will have to visit a medical practitioner and obtain a written certification. That individual will, that certification, the doctor will upload it through the patient caregiver registry on our website. The individual will then go online and apply, again, through our registry on our website. This is all January 1 of 2025. The individual will apply. Once they've entered certain information, there will be the certification will populate. They will be able to capture that and associate it with their application. At that point, they'll have to upload a notarized signature form and pay a fee. At that point, the cabinet will, in that case, approve them if all the information is correct and they don't have a disqualifying felony offense. And then we will email them their digital card. And again, so what are the requirements? Got to be a resident or a visiting qualified patient. You got to have one of the qualifying conditions. And last thing, you have to have no prior disqualifying felony offenses. And we have an API with the Administrative Office of the Courts, so we will be checking. Again, the conditions: cancer, post-traumatic stress disorder, MS, chronic pain, epilepsy, chronic nausea, and muscle spasms. And those are what we have provided in the law, as well as any condition that the Kentucky Center for Cannabis at the University of Kentucky determines medical cannabis would be a sufficient medical device to deal with those conditions. Next, so I talked a little bit about this, and this is what you have to do to actually apply, or the information that you have to upload: information, written certification, application fee, notarized signature page. Now, on to the fee. We have one of the lowest in the country. It's $25 for a purely medical program at the start. So this is a $25 fee that people have to pay, and they will have to pay it upon renewal as well. These are our medical cannabis cards, and I apologize for having an iPhone 5 on here. I should probably have that updated to whatever it is now. But this is what our medical cannabis cards look like. They cannot be counterfeited. They cannot be forged. They cannot be faked. These are associated directly with the patient. They have a patient number, the date of birth of that individual, the date of issuance, and they have a QR code in the bottom right-hand corner. That QR code is for law enforcement. So if an individual was to get stopped, the law enforcement official, one of the first things they can do is scan that medical cannabis card. That will pop red or green to let you know, if you're the law enforcement officer, whether this is a valid card or this is an invalid card. If it is a valid card, there may be some other things that we need to check for, just to make sure that everything is being conducted in accordance with the law. If it is red, then that is an invalid card. And if we need some double checking on that, the phone number for the cannabis program in my office will be provided on that card. Other thing that you'll notice, there is a barcode on there. That barcode is what allows purchases from a dispensary. When you purchase from a dispensary, you have to show your card and a government issued photo ID. They will then scan this barcode. That barcode will subtract the amount of cannabis that you have purchased from your allotment for the month. So for your 30-day allotment, it'll subtract whatever you've purchased from that. A lot of folks will not even purchase their full 30-day allotment oftentimes. Now, with respect to these other cards on the right-hand side, so we have caregiver registry ID cards. Caregiver, think of it this way. Let's assume that for the moment that a son or a daughter is looking after an elderly parent that has stage 4 cancer. And that obviously the person with stage 4 cancer cannot transport themselves to buy medical cannabis at a dispensary, but their child can. That individual would be able to apply for a caregiver registry card. The parent would, of course, have to apply for the regular card. Those would be associated in our website through the patient portal. And you'll notice that there's 2 barcodes on that page. One is for scanning that's associated with the patient. The other one would be scanned related to the caregiver, and that's to track who's purchasing what and when. Caregivers can also, there can be up to 3 patients per caregiver, and caregivers can also and must, in fact, be the folks that purchase for a minor patient. We do not expect a whole lot of minor patients to participate in this, as is the case in other states. However, there are severe medical conditions, and so that may be the case, and it is provided for under the law. So we want to make sure that this is safe and secure for them as well. What you'll notice, there is no barcode on here. Minors cannot purchase. They cannot enter the store. And so they will have to carry their card at any point in time while they are consuming medical cannabis, whether it be at home or wherever, but they will have to have this card, and they can have it digitally on their phone. Moving on, there are fake cards out there. There are businesses that are advertising medical marijuana cards. These are scams. They are false and misleading. They are not in any way associated with Kentucky's medical cannabis program. So if folks are asking you about this medical cannabis card and will it be valid and will it work, the answer is no. Please refer them to myself or to the Office of the Attorney General, who can investigate false and misleading business practices. Next, patient supply limits: 4 ounces of raw plant material or its equivalent per month. That's 28 grams of concentrate. So that's what would go into a nebulizer or a vaporizer. And then 3,900 milligrams of THC infused products. So when we're talking about that, we're talking about edible products and the like. Now, for all the different types of products that are allowed, you can go on our website and check that out as well. Again, here's some more information about physicians and their regulations. Those are currently effective, and they were issued by KBN and KBML. These are electronic monitoring systems. Again, there's a seed to sale track and trace system. Very important to make sure that this is secure. We'll be able to see all of the medical cannabis that's in our system at any one time. And so, for example, if an individual has an adverse event, we can track down the batch, lot, all the way back to the plant or group of plants that product was actually created from, to ensure that any issue would be curtailed, and then of course subject to cease and desist letters and recalls and things of that nature. Okay, now local governments, and this is what I think most of you all are interested in, but I wanted to give you sort of the full breadth of what we have to deal with here. So local government laws, Senate Bill 47, and again, this is KRS 218B 130. That's the place you want to go to look. And that has changed now with House Bill 829 from this year. So under the laws, as they're currently written, that's with the House Bill 829 amendments, local governments may restrict or entirely prohibit licensed cannabis business operations within their jurisdiction. If a county opts out, a city within that county can opt back in. If a county opts out, it can be put on the ballot via petition, and there's a process for that to get the county opted back in. And the threshold amount for that was actually raised in this most recent bill as well. There's a couple ways to opt out. Way number 1 is by ordinance. Way number 2 is by putting it on the ballot. There's some specific rules around schools as well. So specific language from the law. Local governments cannot enact any ordinance that is less restrictive than the statutes or regulations set forth by the program. Local government may not enact ordinances that impose an undue burden or make cannabis operations unreasonable or impractical. So, you can opt out completely, or you can, do the standard time, place, and manner restrictions related to these businesses. But if you've not opted out and you're allowing it, they have to be reasonable restrictions. Next, local governments, and this is a new piece of the law, may establish and assess reasonable local fees to compensate for any additional administration required for the operation of cannabis business within your territories. We got a question from the Magistrates and Commissioners Association this morning, so I just want to sort of head that off. What does reasonable mean? That is a determination made by you, the counties. And so if there's any issues there on the fees, that will be as between the counties and the business licensees. We really want to not insert ourselves as the state between local governments and the folks that are operating in their communities. Again, resolutions may be enacted to allow cannabis businesses to operate, you know, and that can be added to ballot in the next regular election. Let's go. Okay, so next piece, and this is an important piece, at least from the cabinet standpoint. If a local jurisdiction opts out, so if one of your jurisdictions opt out, the law now requires y'all to notify myself and the program within 5 business days after passage, and that's in writing. You can send it to my email address if that's the case, or in any way conveying that writing to us, and that's super helpful to us because it allows us to know, you know, who's in and who's out. And so we don't inadvertently license anybody in one of your jurisdictions if you've decided to opt out. We want to make sure that the licensees know where they can operate and where they can't. Again, and this is another piece here. So the original law, there was a bit of an issue where a business could be licensed in a jurisdiction. Let's say Bourbon County is the one right next to my home. Let's say a business was licensed in Bourbon County and it was a tier 3 cultivator, and it's a 25,000 foot cultivation facility, right? That's a significant amount of capital that would have to be invested into a facility like that. It could be built out, it could be running for several years, and under the previous law, the county could opt out at any point, and that business would essentially have to close its doors. We wanted to avoid having that kind of issue pop up, especially with these kind of businesses. You know, because this is a federally controlled substance, these businesses do not have access to the traditional bankruptcy courts like others do. They don't have access to traditional financing like other businesses do. And so we're very cognizant of the kinds of burdens that could be placed on them. And so we worked with the legislature. And again, I want to thank Representative Nemes and Senator West, and of course the good folks at KACo and the Kentucky League of Cities for helping us address this. And so the solution that was arrived at was ultimately that local governments, even if they have a licensee in their jurisdiction, that they can still opt out until January 1 of 2025. So we're going to be issuing licenses probably in October and November of this year. We'll issue those licenses, and if your jurisdictions still determine that they want to opt out, that they can do so. And then we'll work with the licensee to get them transition to a jurisdiction that allows medical cannabis business operations. Beyond that point, the local government that has an existing licensee can no longer opt out. And any jurisdiction that does not have a licensee, they could continue to opt out until they get a licensee in their jurisdiction. And of course, at any point, local governments can zone and do the time, place, and manner restrictions that we've discussed. Local schools can make a decision about whether they want to be a part of this or not. If they do, then they have to establish policies by December 1 of this year. And essentially what that means is, first, students cannot be able to see the medical cannabis at any point. Second, the administrators or the school nurse have to administer the medical cannabis. This is very similar to the same policies that schools have in place for any other prescriptions, including some fairly significant ones like opioids or other things, right? So this is not much different with that in that respect. And so those are some of the requirements around that. And again, there's an opt-out allowed for the individuals. So if an administrator or school nurse says, I don't want to administer cannabis, then they can make the decision that they personally do not have to. So again, that touches on those pieces, and those policies have to be in place December 1, 2024. Again, there's a petition process for local governments on opting back in. That's all set forth in KRS 218B 130. So I would highly recommend you take a look at subsection 5, 6, and 7 on how that piece works. We've provided on our website a zoning tool. I hope that some of you have had the opportunity to take a look at what that is. It is informational only, because the only zoning restriction in our law, because we have not put any in our regulations, the only restriction in our law is that these facilities have to be 1,000 feet from a school, which is a primary or secondary school, which is undefined, and a daycare facility, which is undefined. So what that means is, and we've defined it as obviously public primary and secondary schools, and all KDE certified primary or secondary private schools. Secondly, with respect to the daycares, there are several different daycare facilities that are regulated by the cabinet, and they're technically called childcare facilities, and there's a couple different names for them. We had some or some comments made during the notice and comment period on that, and so we'll have some final guidance on what our definition of those are here in the next week or so. Back to the zoning tool. So we don't have the GIS information for all of these facilities, but the measurement is boundary to boundary. And so what we did was draw our 1,500-foot halo around each one of these facilities. So you can look at the map and see sort of where these facilities are. And these are really to just get people thinking about, okay, where might these things show up in my community? And how might we want to start looking at the regulations at a local level for zoning, and going down that path. So again, informational only, but certainly a tool that I highly recommend you take a look at and see where these facilities are in your areas. Okay, with that, I have concluded the presentation piece and am happy to begin answering some questions.
Thank you so much, Sam. And a number of the questions here are related to cities and counties and the interplay there with licensing. But before we take those questions, I'd like to introduce Franklin County Judge Executive Michael Mueller, who serves and represents counties on the governor's working group on cannabis. Judge Mueller, would you like to say a few words?
Yes, thank you very much, Jennifer. You know, you called me probably about a month ago to kind of talk about things and see where the task force was, and I was very appreciative of that. But I think, like I told you, there's still a lot of unknowns. I apologize for being late. You know, I told you I wanted to go in front of Sam because Sam was going to answer all the questions. I truly want to thank Sam and the team and the governor for doing this. I will say to all the county judges out there that they are handling this like a pharmacy. And I think Sam said that earlier. You know, a lot of people think of cannabis as just weed and dope and things like that. But every conversation we've had for the last year has been very professional. It's very safe. They're worried about the safety of everybody. But I think this will do some good. You know, ultimately, I think what everyone needs to talk about with their courts and their cities is, do you want to be able to have it in your community? Yes or no? I think that's the toughest decision right off the bat. After that decision is made, you know, you can move forward for there. Some of the things that we've talked about, there's a lot of unknowns in the workforce. You know, we all have a big workforce. How do we handle that? How do we handle if somebody tests positive? DOT regulations is a federal mandate. So if you have first responders, if you road departments, things like that, they follow federal guidelines. They can't test positive at all. Bottom line, end of story. So, but how you handle everybody else, is something I think we all need to figure out together. But I just, again, want to thank the governor. I want to thank Sam, KACo for putting this on. I mean, it's an amazing topic we need to talk about. It's coming fast and hard. So, you know, I'm here. I'm appreciative that I'm the local representation on this task force. So anybody can reach out to me. And if I don't know the answer, then I'll find it for you. But I think we're all figuring this out together. And I appreciate Sam for being on here today. And Jennifer, thank you for reaching out.
Wonderful. Thank you so much, Judge. I'm just going to quickly, since we are coming up on our hour here, introduce the KACo team and then start just taking questions. So we've got Shelley Hampton, who is the Director of Government Affairs here at KACo. We have Tim Sturgill, our General Counsel, and we have Rich Ornstein, who is the KACo Attorney Extraordinaire. So I've got some questions here in the chat, and I'm going to ask them of the KACo team and Sam. Anybody that wants to jump in, Judge Mueller, and answer, please feel free. So first up, we have a question about counties and cities. Let me scroll back here to good. If counties choose to ban medical cannabis, can cities override that decision within city limits? Anybody who wants to take it?
Happy to jump in and happy to answer as many as you like, of course. Yes, the answer is yes. So if a county opts out, a city can opt back in for the city. Obviously, that wouldn't expand beyond the geographical bounds of the city.
All right. I had a question today from a member of DCBS. They shared that if somebody in a home states that they are on medical cannabis and can show the proper credentials, then any THC found in a drug screen is going to be ordered void. What is to keep them from taking synthetics and other non-regulated cannabis consumables?
That's a great question, and I would love to have a conversation with the individual from DCBS about that. I think there's a couple working pieces there, but I'd need some more information from DCBS.
Okay. The city county question: if a city allows it or the citizens have a successful petition to allow it, can it later be rescinded if problems arise from allowing the sale or production of medical cannabis?
Yes, it's my understanding, yes.
All right. Can a county add in a license fee of their own if the business is going within the city?
So it's my understanding that the answer to that is yes, and that's provided for under the new amendments to Senate Bill 40, well, to KRS 218B 130 that were provided for in House Bill 829. But again, I would take a very close look at 218B 130.
Okay, let's see. Will the price of cannabis be controlled, or can the business charge what they feel is allowable in their area? Also, will insurance companies cover this as a pharmacy issued drug?
So there's two questions in there. The first is no, the state does not control the price of cannabis. These are private businesses. The private businesses will set the price of their medical cannabis. Again, we developed a market that is growth oriented, so it will grow to the extent that the patient population grows. So we want to make sure that these businesses are sustainable and the like going forward. The second question, will insurance companies cover this as a pharmacy issued drug? These are not FDA approved products, and they are not issued by traditional pharmacies. You will not see this in a Walgreens or a Rite Aid or the like. Traditional pharmacies have not gotten into this space for a number of reasons. Some to do with tax, some to do with the fact that it can't cross state lines, and things of that nature. Rescheduling of medical cannabis may have some impact on that. We will have to wait and see. With respect to requirements that insurance cover this, 218B 150 specifically states that they do not.
Okay, let's see. Any discussions about retraining or training of new canines?
So that's a question that I think would have to be taken up with KSP and DOCJT. One of the things that we're looking at right now, and that we'll be working with the Team Kentucky Medical Cannabis work group with Judge Mueller in the coming weeks and months, is providing a guide, much like the Occupational Safety and Health Guide, but a guide for law enforcement officers and how they interact with this. And we'll also be working with the Justice Cabinet, KSP, and DOCJT to ensure that those materials comport with all the things they have to comport with from the law enforcement side, and provide information, again, for law enforcement officers. And we're working very, very hard on that. So you can look for that in the next several months.
Great, and I put a link in the chat. We have a resource page for county officials on our website, and a lot of these questions, as we get answers to them, we'll put them on that website. So that'll be an easy place for you to go and get some county specific answers on some of these things. Will there be form language prepared by KACo for a ballot question? Tim or Rich, any thoughts on that?
We, last week, Jennifer, the week prior, we sent out a resolution that a county could use if they want to put the issue on the ballot.
And the actual question that goes on the ballot is specified in the statute, so it'll just be straight from there.
There you go. Let's see. If the city and county both want citizens to decide, is it one question on the ballot or two?
Jennifer, I think since both the city and county could pass a resolution putting it in front of the voters, I suspect we could end up with a county having the question on the ballot twice. One's for city and one for county.
Okay. Can you honor other medical states' cards? Does this program, the Kentucky software, communicate with other states, or is it restricted?
So 2 questions in there. The first one is yes. So we have provided for in our law what is called a visiting qualified patient. So folks from out of state, and again, they have to have one of the conditions that we allow under our law. And just to sort of remind you all, the qualifying conditions that we have in Kentucky it's basically the most restrictive list in the entire country with respect to medical cannabis. So folks from out of state, they can come into Kentucky, they can purchase medical cannabis here if they have the qualifying conditions and follow some of the other rules and regulations. Again, that's provided on our website. If you have more questions about that, you'll need to go there. With respect to our software does not communicate directly with other states. Every state is an insular system. So our state is all Kentucky. What we can do is require those individuals to verify that they have a card in another state, and we know what those cards look like, and we can also require them to apply to us for a Kentucky issued card during their visiting stay. And so that is also provided for on our website.
I'm muted. If a county elects to opt out, do they opt out from all licenses? Can you opt out of one particular type?
That's a great question, and that's one that we got earlier today. From our understanding, if you opt out, you are opting out of all cannabis business operations.
Sure.
Let's see. Will the executive order remain in place after the launch of the program? For example, if someone has a valid prescription but has lost their card, does the EO still apply?
So the EO runs indefinitely until it is revoked by the governor or some subsequent administration. It is my understanding that that's going to remain in place.
Looks like part 2 of that. May counties control where the dispensary locates through zoning, or
Yes.
must it be treated like any other retail business?
Yes.
Related to the undue burden language of KRS 213B.
Yes, they can.
Who will the reasonable fee go to, city or county, assuming both allow medical marijuana and the business locates within the city?
So again, I would highly encourage folks to go to section 130 of KRS 218B and take a very close look at it. It's my understanding that either or both.
So I think that the statute says if both allow, that the fee will be, distributed in accordance with an agreement between the localities.
Yep.
And it's only one fee.
Will there be any new specific KRS laws created for violations of this law covering fraudulent licenses, illegal sales, sales over the limits, et cetera?
I don't think I understand. So first of all, and I think I can handle this in reverse order. So sales over the limit. So a sale that would happen over the limit that an individual has for their 30-day supply. First of all, they would be prohibited from doing that in the metric system. So that would immediately be stopped right at the point of sale. So the metric system basically says, this is what your allotment is. This is written on your certification. You can go no higher than this. And so we would be able to see any cannabis that leaves the manifest for that facility beyond the amount that individuals are allowed to purchase. So in short, we would be able to see that. And that would be diversion of medical cannabis, which these businesses to be licensed have to agree that they will not do. So it would put immediately in jeopardy their license. So their license could be revoked. So that's already provided for. Illegal sales of cannabis, same sort of situation. Again, our track and trace system is great. It's the one that's used by 24 other states. It is the licensing system that folks, generally speaking, use around the country. It allows us to see if there's any diversion of cannabis outside of our system. And we have strict requirements on ensuring that there's manifest in any kind of transit, as well as at the dispensaries, the processors, and the cultivators. So we'll know exactly how much product that they're supposed to have at any one time. The last thing is, will there be any new laws for violations? Again, that's covered in the powers and authorities that were provided to our office under House Bill 829. So again, thank you to Senator West and Representative Nemes for their work on that.
All right, thank you, Sam. That was rapid fire. You handled it well. Unfortunately, we are running out of time here. I would encourage everybody to keep putting your questions in the chat, because we are going to put a frequently asked questions section on our website where we can hopefully answer most of these questions as well. So we have recorded this. We'll send out a link to the recording later, as well as all of the materials, any links to any additional resources. To everyone that's registered here. But I'll stay on for a little while. People put their questions in the chat. Sam, thank you so much for being with us. Amazing. Judge Mueller, thank you so much for your support. And we appreciate everybody being with us. Stay safe out there in that weather.